Hello, hello everyone. Welcome in. Hello, welcome. If folks want to check in the chat feature and say where you're at, where you're joining us from, that'd be great. Hello, New York, Arizona, Oregon, Connecticut, Vermont, upstate New York. It's a big, big area, Sharon. Northern California, Florida, New York, New Jersey, Virginia, Tennessee. Hope you're staying warm there in Tennessee. Yeah, frigid Washington. I'm here in frigid Chicago, not seeing any neighbors. Oh, well, there's Richard in Lebanon. Hi, Richard. Okay. Just going to give folks another moment to join. Okay. All right. I think we're going to go ahead and get started. Hello and welcome to Compassion and Choices National Medical Aid and Dying Action Center's 2026 State Legislative Kickoff Webinar. I'm Patrick Donges, Digital Engagement Director at Compassion and Choices, the nation's oldest, largest, and most active nonprofit dedicated to improving care, expanding options, and empowering everyone to chart their end of life journey. Before I introduce our presenters here, I appreciate your attention to a few details that are going to help you get the most out of our program today. Live captioning, including translated captions in Spanish and a variety of other languages, is available by selecting the closed captioning double C's. That's the CC icon that you should see on your screen now in Zoom. That'll be on your Zoom menu. You should be able to access closed captioning. There will be time for questions and answers toward the end of the program. We are going to open up the Q&A section as we get closer to that part of our program toward the end, and our panel will answer as many questions as time allows, and we will only be taking questions using the Q&A feature. And on that note, we have at this point limited the chat feature because we want to ensure that we have the time to answer as many of your questions as possible during the Q&A. This movement is full of tenacious advocates, and we're so grateful for your participation. Please look for more information in the coming weeks on opportunities to join a local action team and to connect with like-minded advocates in your area. And stay tuned to the Medical Aid and Dying Action Center newsletter to hear what folks are doing to support the movement across the country. We're also looking into providing more opportunities for connection between folks in different regions and states in digital or virtual settings in the coming weeks. So again, stay tuned to the newsletter for that. And lastly, this webinar is being recorded, and a link to the recording will be sent via email to all registrants. That'll happen tomorrow. So I'm now happy to welcome Compassion and Choices National Director of Legislative Advocacy, Elizabeth Armijo. Elizabeth.
Great. Thank you, Patrick. I appreciate it. It's wonderful to be here this afternoon, and it's really great to see the names of so many of our allies and advocates from across the country. So thanks for joining us today. So even when national politics seem to consistently dominate the headlines lately, states continue to make meaningful progress on end-of-life care issues, including medical aid and dying. The majority of state legislatures have kicked off their legislative sessions. Currently, 11 states have medical aid and dying authorization bills that have been introduced or that have rolled over into the 2026 session. Those states include Arizona, Indiana, Iowa, Massachusetts, Minnesota, Missouri, Pennsylvania, Tennessee, Rhode Island, Virginia, and Kentucky. We also anticipate there will be at least 2 to 3 more states introducing as well. In Washington and New Jersey, lawmakers have already introduced medical aid and dying improvement bills. In New Jersey, the bill mirrors last year's proposal, allowing the 15-day waiting period between the 2 oral requests to be waived under certain circumstances and permitting the time between the 2 initial oral requests and the written prescription to be reduced to 48 hours. In Washington, the bill creates a waiver of waiting periods for three categories of patients: those unlikely to survive the waiting period, those at risk of losing the ability to self ingest, and those who would experience untreatable pain and suffering due to the waiting period. Our policy team has completed a detailed analysis of both proposals and have submitted recommendations back on those bills. On the defensive side, we're currently tracking a bill that was introduced in Illinois on January 14th that tries to repeal the medical aid and dying bill. The folks on the ground are staying closely engaged there, though our lobbyist believes it's unlikely to even get a hearing. And in North Carolina, there was legislation that rolled over. It's bipartisan legislation that rolled over, and it's a study bill, and it's in the second year of its session. This week, we've already had a flurry of activities, especially in the last couple of days in New York and Virginia. I know many of you on this call may have been there in person or have been closely monitoring what's happening in both those states. Both those campaign directors will join us. We have one that's here with us now, and that will join us later. So I'll probably interrupt the call when she's able to join us. I know that she's on an airplane at the moment, so I'll pause the presentation briefly so that she can jump on and give us the latest in what's happening in Virginia as well as Massachusetts. But Corinne Carey, the senior director in New York and New Jersey, is joining us right now. And Corinne, can you give us an update on what's happening in New York?
Yes, thank you so much, Elizabeth, and thanks everyone for joining our call today. Uh, I don't have the word to describe how I feel right now, given that both chambers of the legislature in New York passed the amendments to New York's Medical Aid and Dying Act, which was approved by the legislature in the spring. And then Governor Kathy Hochul requested a number of amendments. She called for the bill to be delivered to her back on December 31st. But the way that this is working in New York is that she was waiting for the legislature to pass the amendments she requested before signing the bill. As many of you know, especially those of you in New York who've been following closely, she has until midnight Friday, which is tomorrow, to sign the bill. And we expect that she will sign the bill tomorrow. Yesterday, both the Assembly and the Senate debated the amendments on the floor late yesterday afternoon, early evening. And our bill sponsors did a tremendous job. As those of you in New York may know, Senator Brad Hoylman Siegel is no longer in the Senate. He's been our Senate bill sponsor for quite some time. But Senator Gustavo Rivera, the chair of the Health Committee, picked up the bill and debated it on the floor. And both he and Assemblymember Amy Paulin did a fantastic job. We picked up a few votes in the Assembly from people who had previously voted no, and the bill is on its way. The bill with the amendments is also on its way to the governor's desk. So once she signs this bill, New York will become the 13th state and the 14th jurisdiction to approve medical aid in dying. One of the amendments that Governor Hochul requested was to delay implementation. The bill passed by both chambers of the legislature in the spring had what's called an immediate effective date, meaning the minute that the governor would have signed it, the bill would have gone into effect. The governor was concerned that the Department of Health would not have enough time to create regulations and guidance for providers, and so she asked for a 180-day implementation period. This means that the law will be effective on August 5th, and our work between now and then will be not only a massive public awareness campaign in New York, which will include me traveling the state, working with local groups to do public education seminars and speaking, but also regional celebrations. And so if any of you in New York are interested in helping us host a regional celebration, certainly get in touch and we'll put you on a host committee. But the other part of our work will be working with the Department of Health to ensure that the regulations that they adopt governing the practice of medical aid in dying in New York are closely mirrored to what the legislation requires and don't go beyond that. So what we're looking for is to make sure that the Department of Health does not adopt rules and regulations that create unnecessary extra statutory barriers to care. Once those regulations are issued, we will likely be commenting on the regulations as they are finalized. And then from there, we'll be monitoring implementation. We're working closely with our partners on the ground at End of Life Choices New York, along with the Academy for Aid in Dying Medication. Those groups have been focusing their efforts on recruiting and educating providers, while we'll be spending our time educating the public. So we're working hand in hand with them on those pieces, and we'll be monitoring this to make sure that people who seek to access medical aid in dying are not prevented from doing so by some of the new amendments and strict requirements that New York requires. For example, a mandatory mental health evaluation by a psychiatrist or a psychologist, a 5-day waiting period that can be waived if the doctor believes that the person won't be able to survive the process, and a first of its kind in the nation, mandatory audio or visual recording by the person requesting medical aid in dying that will be appended to their medical record. So those are some of the changes that Governor Hochul recommended that were approved by the legislature yesterday, and that we'll be keeping a close eye on in terms of whether they impede access or not. So I'm going to stop there and see if Elizabeth has any questions or anything she wants me to hit on before I jump over to our team meeting in New York, where we're going to be talking about what the governor's signature process will look like tomorrow.
Thank you, Corinne. I can't help but think that you have personally been involved in this campaign, in this effort, in this movement in New York, as well as across the country for over 10 years. So I can't imagine what you must be feeling right now, so I won't even try. But what are you hearing from the advocates and allies that you work with on a daily basis, in reference to where you are in this process, where we're just moments away from the governor signing? What are some of the things that you're hearing or have been shared with you from your advocates and allies?
Yeah, I mean, my email box is exploding with reactions from our volunteers who've been with us every step of the way, to people who are just now learning about this action. And I have to say, it's overwhelmingly positive. It's not easy. I think despite popular perception of New York being considered quote unquote a progressive state, and this is not necessarily a progressive issue, but it's perceived sometimes as being that. And I think the people outside of New York may not understand how difficult it is to get laws like this passed. And so people in New York are relieved, they're excited. And the one thing that I worried about quite a bit is that some of our seriously ill advocates might feel that they won't be able to take advantage of this law because it won't go into effect in time for them. But 201, each one of those people that I've worked closely with feels tremendously grateful, and I feel like they're all even feeling the palliative benefit of knowing that this will be law by by August, I guess. There's something really incredible about just knowing that this is an option that gives people peace of mind. Having autonomy where a terminal illness has taken away so much is a benefit in and of itself. So that's really what I'm hearing from our advocates.
Right. Thank you, Corinne. I know you want to jump to your state team, but we may reach out to you later if we have questions about New York that we have to answer, and we can answer those via email or phone. So Thank you again for jumping on today and being a part of this. We appreciate the updates, and congratulations to you and everyone in New York who worked tirelessly on this. We really appreciate your efforts.
No problem. I am always available for questions, Elizabeth. Thank you so much.
Thank you, Corinne. Congratulations. Please send
Thanks.
my congratulations to the team.
I will. Thanks.
Thank
Bye-bye.
you.
Yeah. Thank you. She's been an amazing colleague to work with over the last 10 years, and I'm incredibly proud of the work that she and others have done in New York. So it's been an emotional time for sure. So.
And speaking of New York and New York being one of the most populous states in the country, you spoke about where we're at in our legislative landscape in these opening weeks. Can you tell us a little bit more about the strategy behind our work this year, please, Elizabeth?
Yeah, absolutely, Patrick. And actually, I shared some of this strategy last time we were on a national webinar together, but it's important to go over it again. So, but I shared that the information about Compassionate Choices long-term objectives, and that in 2026, our focus will again be driven by ensuring that at least half the US population lives in states where medical aid in dying is accessible and fully integrated medical practice. And as benchmarks towards that, we will continue to work on ensuring that every region of the country has at least one state where medical aid in dying is accessible to all qualified individuals, including those who reside outside those states, while also creating pathways towards authorization in large, politically challenging states. So, yes, we're thinking nationally, we're acting regionally, locally, and we're always keeping our eye on the long game. So, I want to zoom out for a moment, and no pun intended, but I want to zoom out for a minute and talk about where we are headed and why our strategy looks the way it does this year. Our long-term objectives are straightforward. By 2028, with your help, we aim to ensure that at least half the US population lives in a state where medical aid in dying is authorized. This goal isn't abstract. It's grounded in more than 3 decades of advocacy and real measurable progress. Medical aid in dying is increasingly understood as part of the gold standard of fully informed, patient-directed end-of-life care, and our strategy reflects that reality. When we talk about half the population, we are talking about people, about families, about patients, clinicians, not just the states that are on a map. Today, there are about 258 million adults in the United States. Our goal is to ensure that at least half, which is roughly 129 million people, live in a state where medical aid in dying is accessible. Right now, nearly 58 million adults already live in states where medical aid in dying is authorized. With Delaware, Illinois, and New York, that number grows to almost 85 million people. That leaves a gap of about 44 million adults to help reach our 50% goal. So here's why that matters. The states that we are already actively investing in right now, the strategic focus states, account for nearly all of that remaining population in that goal, which means that with your help, this goal isn't aspirational, it's achievable. Our 2026 strategy is about prioritizing states where progress expands access for millions while strengthening the movement nationally. Massachusetts has strong legislative movements where leadership dynamics, not the public support, remains the primary barrier. Maryland helps build density and continuity in the Mid-Atlantic corridor. Virginia remains a strategic long-term opportunity. While today's vote underscores how narrow margins can be, the presence of a supportive governor, engaged legislative champions, and increasingly informed public means that continued education, relationship building, and refinement can meaningfully shift the terrain in the future sessions. Florida is essential. It's politically challenging, but it's critical to the national normalization. Success there could reshape how medical aid in dying is understood across the country. Also, we're committed to supporting volunteer-led campaigns nationwide in other states, with varying degrees of assistance tailored to each campaign's needs. Regional access matters too. By 2033, our goal is that every region of this country has at least one state where medical aid and dying is authorized and accessible and welcomes out-of-state residents. So in 2026, that means we continue our work in Minnesota as the upper Midwest anchor, that in Virginia as the Mid-Atlantic and Southeast bridge, and in Florida as both a population driver and a cultural inflection point. Regional access reduces inequity, travel burden, and misinformation, and reinforces medical aid and dying as a standard medical care, not an anomaly. But building a broader, more durable coalition is also important. We want to work to create a viable path to authorization in large, politically complex states like Florida and Texas. And we know that that will take a while. We want to triple the active Republican and Libertarian supporters because we want to ensure that political representation better reflects the actual public support. Also, I want to point out that we are working in some states that aren't prioritized for population size or regional access, but for their movement strength, like Connecticut and Nevada. They're examples of places where long-term investment, strategy refinement, and sustained lawmaker education support continued progress over time. Nevada does not have a 2026 session, but the groundwork there continues. And in Connecticut, the session started yesterday, and legislation is expected to be introduced soon with active coordination among the staff, the lobbyists, and the lawmakers on bill language. Finally, every expansion win increases the target on existing laws. Our long-term objective here is clear: defend the full range of patient-directed end-of-life care and prevent erosion of these existing laws. In 2026, that means proactive engagement in places like California and New York, close monitoring at the federal level, and continued integration and normalization work, even in states without active sessions like Montana. Defense isn't reactive. It ensures that progress is protected, normalized, and sustained. To summarize what we anticipate, that medical aid and dying legislation will be introduced in at least 15 states this year. Among them, our strategy is to have active campaigns focused on public awareness, education, and groundwork building. We'll be doing that in Maryland, Massachusetts, Minnesota, Connecticut, Virginia, Nevada, and Florida, while continuing to support advocacy efforts in numerous other states where this work is advancing through education, coalition building, and grassroots engagement. This approach reflects the reality that real change that sticks does not happen in a single session. It is built over time through sustained investment, trust building, and repeated engagement with communities and lawmakers.
Thank you so much, Elizabeth. I am going to go ahead and open up the Q&A to folks if they want to start adding questions there. And we are joined now by our Regional Advocacy Director, Melissa Stacy, who just stepped off an airplane. So I want to give her a moment to get logged in here. And just I'll speak briefly about a couple of links that I posted in the chat. One is some descriptions of the amendments that passed yesterday in New York, if folks are interested in that. That webpage also includes much more information on the New York bill and what we expect going forward for our access work. And I also posted a link to our volunteer sign up page. And I encourage folks, if you haven't signed up to volunteer, please do check out that form, and there are opportunities to tell us what you're interested in from a subject matter perspective in the end-of-life care options movement, and we will get back in touch with you with opportunities to volunteer locally, regionally, across the country. And seeing that Melissa did hop off, I am going to I'll give a little update on our legal advocacy landscape as well. Um, Defense of fully informed patient-directed end-of-life care doesn't just happen in legislatures; it also happens in courtrooms across the country. And we have our Compassion Legal team working um, tirelessly to ensure that that the laws that are in place are defended and folks are able to access their care that they want and need. Melissa, are you ready? I'll drop my federal or my excuse me my legal update for now if you're ready to chat through what's been going on in your world.
Hey, Patrick, I am ready. Thank you so much. Can you hear
Very
me
welcome.
okay?
Yes,
Wonderful.
perfect.
Thank you. Thanks for the opportunity to hop in. As I heard you say, I did just step off a plane from Virginia heading home. And so I'm in the airport waiting for my bus. It's been a really eventful week in Virginia. I'd say probably 2 weeks now. Last week, we had an incredible week of action where advocates from across the Commonwealth had the opportunity to reach out to their legislators, and we had over 1,000 online and in-person actions taken, including meetings with all members of the committees of jurisdiction, which was incredible. Their session moves really quick, and so we did too, and the team there is amazing. And I had the opportunity to go down last week and do a lot of in-person meetings with the team, and then join them again this week because we had a subcommittee vote on the bill. That was Tuesday, and we had about 20 advocates show up in person, as well as I would say over 50 submit written testimony. At the end of my oral testimony, I had the opportunity to ask our advocates to stand up, and they did to show their support. And it was really clear that we outweighed the opposition by 2 to 1. It was amazing to see. And the committee took a vote, and the bill passed subcommittee by a vote of 3 to 2 with one abstention. Advocates and myself had the wonderful opportunity all day yesterday to visit legislative offices in Virginia and talk to the members of the full committee who were going to be hearing the bill this morning. I think we probably had about 20 meetings yesterday on medical aid and dying, had some really incredible conversations and shared stories. The full committee of Senate Health and Education took a vote this morning. And before they did, our lead Senate patron, Senator Jennifer Boysko, took time to really outline what the bill is and the safeguards and eligibility requirement and protections in it, which was phenomenal. Unfortunately, the bill failed the vote in full committee by a vote of 7 to 8. And so unfortunately, we are done pushing aid and dying, our option in the Senate for this year. We're unable to move forward for this session. But I met with the advocates afterwards. The team there is amazing. There was a lot of tears and a lot of encouragement of each other in the work that we all do that has gone into it. And so for those on the call in Virginia or with Virginia Connections, thank you so much for your work. We are not done. We're going to continue to push harder. We have some incredible champions there, and we look forward to continuing the work.
Thank you so
Melissa?
much, Melissa.
Yeah, thank you, Melissa. Again, thank you so much. I know that this has been an incredibly long day and that you're in travel and you're traveling back to Boston and back to Massachusetts, where you also work on that campaign and work on the ground there. I know that it has been an incredible, week over the last couple of weeks for you and the staff and all of the volunteers and supporters there in Virginia. So again, I just want to express my appreciation for all of the folks who showed up and showed out over the last few days in Virginia. So thank you for that. And I know that the work continues. This is a long game. We have a long commitment there. So I know, again, without a shadow of a doubt, that you all continue the work there. And like you said, amazing allies that you have there. And I know you need to jump on a bus. If I could, real quickly, since I have you, anything that you want to share about Massachusetts? I know you're kind of switching gears, but anything that we need to know or anything you want to share about Massachusetts?
I think from a Massachusetts perspective, things are continuing to pick up. I really encourage if anyone's on the phone for Massachusetts to please reach out to your senator. The bill is currently in Senate Ways and Means. I know that conversations have been happening amongst members and really our lead bill sponsor, Senator Jo Comerford, who is phenomenal, and her team of senators, Senator Brownsberger, Fernandez, and Oliveira have been lifting this bill up to leadership as well as their colleagues and really encouraging them to move forward. And so any outreach that folks are willing to do to their senators, just to encourage them to work with their peers on Senate Ways and Means would be great. A couple of weeks ago, we had an incredible I want to call it a day of action at the State House where a group of advocates came in and met with every single member of or their staff of the Committee of Senate Ways and Means and had some incredibly meaningful conversations to help encourage them to move the bill forward to a full vote in the Senate. And so we're continuing to support those efforts through some digital advertising and email campaigns. If you're on our email list in Massachusetts, you should be receiving some information in the next, I'd say probably week or so. But please feel free to reach out, make those connections, even if you've already asked. It's okay to ask again. They need to hear that constituents really want this. And we're hopeful that the bill will move soon from Senate Ways and Means to the floor.
I'm going to post a link to our online form to contact your lawmakers in Massachusetts in the chat for folks. Thank you so much again, Melissa, and safe travels home.
Thank you. And thank you for posting that, Patrick. I appreciate it. Thanks for the opportunity. And to all the advocates, thank you for all that you're doing.
Thank you, Melissa. Safe travels.
Thank you, Elizabeth, so much. Bye-bye.
Let's take care.
All right, we have the Q&A going here. I'm going to post that link to the Massachusetts form here in chat. And let me find my place here. I did just want to briefly update folks on legal advocacy. Our most recent case with the resolution is a federal judge in Delaware denied the request of a coalition of plaintiffs to temporarily block the Ron Silverio Heather Block End of Life Options Act from taking effect there on January 1st. It did take effect. Delaware now has the option to medically aid in dying. After reviewing the parties and Compassion Legal's arguments, Judge Gregory B. Williams, federal Judge Williams, dismissed the lawsuit entirely, agreeing that the law is entirely voluntary and contains numerous safeguards. So courts continue to reject claims that medical aid in dying laws are discriminatory or unconstitutional, which strengthens our legal foundation and our policy foundation across the country. And if folks want to know more about what's going on with our legal advocacy, I will also post a link to our Compassion Legal page. Compassion Legal is, of course, the only nonprofit law firm in the country working specifically on end-of-life care issues. So we appreciate folks checking that out. Before we get to our questions, Elizabeth, tell me a little bit about why 2026 is so important. Why is this year vital for the movement? And we just came off such a great year with 3 legislatures passing bills.
Right, and that's exactly why. I mean, the movement across the nation has been incredible. There are allied organizations, there are advocates, there is just a burst of energy in the movement over the last few years, and you could see that in reference to the passage in Delaware twice, and then the signing of the governor, and then the passage in Illinois and the signing of the governor, and then the passage in New York as well. And so 2026 is incredibly important. We have our midterm elections coming up, so that kind of will kind of set and frame things for us in the future. But it is an incredible year, and I think playing off the momentum of what 2025 looked like and what we're looking like in 2026 in reference to the governor signing in New York is going to be incredibly important. So.
Amazing. Thank you so much.
Exciting times for sure. And
Yeah.
again, no matter where you live, though, Patrick, no matter what state you live in, there's really meaningful work that needs to be done, and that every conversation, every relationship, every volunteer hour, anything that helps lay that groundwork for the future progress of this movement is incredibly important. So.
All right. Well, thank you, folks. We have questions in the Q&A here. I do want to just off the top answer. There's a question about federal government and what they're looking at in Congress in terms of medical aid and dying. We do next month, we will have a federal update webinar that, again, I encourage folks to stay tuned to your email for more information about that. Congress and the federal government, obviously, it's very volatile. It has been for a while, but especially right now with funding, and we want to make sure that we have the most up-to-date information and our federal team on the line to answer those types of questions. We did yesterday hear from our man in DC, Nelson Garcia, who told us that through the funding being approved by Congress for the government, that we have essentially protected DC's death with dignity law for at least another year. Is that correct, Elizabeth?
Yes. Yes.
Okay, great. So that's one small update, but we'll have much more on the federal webinar next month.
I think it was until September 30th, which will feel like a year, but I believe it's protected until the end of the fiscal year, which is September 30th.
Got it. Okay, perfect. We have a handful of questions in here about, what are some of the arguments against supporting medical aid in dying, and what are the best responses? I encourage folks to sign up as a volunteer and get in touch with your local action teams or other volunteers in your area who have been doing this work to kind of chat through in person. It's tough to dispel myths without repeating them. It's tough to combat misinformation without repeating it. But from my perspective, there are a handful of categories that people base their opposition in, and they all kind of funnel up to this idea of people being afraid of having their own autonomy, having their own right to decide their end-of-life care options based on this legislation, which, as was mentioned earlier, courts and have decided, recently that this is just one option. It's one practice among many in terms of end-of-life healthcare, and that's my bottom line in terms of when folks come back with opposition, to just remind people it may not be for them, but for those who it does help, and those who are able to access it, it makes a world of difference.
Yeah, it's a great question, Patrick, because we have advocacy trainings. Those trainings happen in the states, right? With those state leads. There's like a Western training that takes place too. I think that one's quarterly, and they do a real deep dive into the advocacy training in those areas. And these are exactly the sort of things that they cover, right? They talk about the sort of things that you might hear from opposition, how to handle them, how to respond to them. So joining those trainings would be definitely something that you might do at the local level. Checking out the 2026 policy book too, that I believe that link was shared as well. That has great information in there as well, and talks about some of the different things that we're seeing and that we're hearing. And just yesterday, we heard all of them again in the public hearings that we were listening to. So those are great resources and places where you can find information on that. And we could actually do a whole other workshop on just how to address those. So.
Yeah, and many more trainings and opportunities to learn more about the way that we talk about our work and how we achieve success talking with decision makers. A good place to start is that policy book. I just also linked that in the chat if folks have time to look there. Looking through the Q&A, a lot of questions related to some bigger questions about end-of-life care and planning. We'll have a slide with our call compassion line on it at the end of the presentation. If you have issues accessing care for yourself or loved ones, please do call the call compassion line. Email us at info@compassionandchoices.org, and we can have someone get in touch with you to talk about getting you the care that you're looking for. And a lot of questions about Massachusetts. I think we covered a lot of them. Welcome back, Corinne.
I think Melissa covered a lot of the things about Massachusetts. There was a specific question about whether a single committee or single committee chair was a holdup, and yes, that most definitely is the case. It's the Speaker of the House is where they see conversations are stalled and is a barrier for sure. So there's a lot of activity around that, a lot of conversations, but I think Melissa did kind of try to address the other things about Massachusetts. But yeah, kind of looking at that question in reference to what was the barrier there. Yeah.
Great. Excellent. Just scanning the questions again. A lot about Massachusetts. I'm so glad Massachusetts is so fired up because that is a state that we are still working in a very significant way.
There is a question about Florida, though, Patrick, and I think I mean I just want folks to understand that this is a long game, right? And in Florida for a long time, Nicole Reyes Palma and others have been working to educate the community. There's been a lot of outreach and education there around end-of-life care and end-of-life care decisions and planning. And there is a local group there in Florida as well, a local organization, Death with Dignity Florida, who have also been in the community working to educate folks as well. So Compassion Choices has, I think, over 10,000 supporters there and a couple of hundred volunteers. They have action teams across the state. They do a lot of health cares. They do a lot of presentations in the community. And they're also looking at and supporting some legislation currently around POST. And in addition to that, it's anticipated that Florida may introduce medical aid in dying legislation again this year. And so, education to those lawmakers, people who live in Florida, joining an action team, leading an action team, educating your lawmakers, sharing your stories, helping with the grassroots outreach, and just really staying engaged, and we have to stay engaged year round, regardless of whether or not we're in session or sessions out, we need to stay engaged year round. So there's lots of opportunities in Florida, and having these conversations now are incredibly important if we're going to kind of really lay that framework and lay that path towards, a long-term authorization there.
Thank you, Elizabeth. I just posted also a link to some resources on additional documents that spell out end-of-life care decisions, including you mentioned POST, and that's for those who may not know, that's Physician Orders for Life-Sustaining Treatment. So it's an additional advanced care planning document. It's also sometimes referred to as MOLST, MOLST. Corinne, we did get a question just now, just as you jumped back in, about the status in New Jersey. And the bottom line is that medical aid in dying is available in New Jersey, correct?
It is available in New Jersey, and we've got some really good resources on the ground to help people in that state. And we're working really closely with legislative champions to amend the law to shorten the waiting period, and maybe even look at some residency tinkering. We're still in discussions with leadership there. I know that folks who are signed up for our Action Alerts from New Jersey will likely be getting a message soon asking them to contact our bill sponsors to light a fire under them because as you know, many of these lawmakers carry a lot of different bills and we want them to prioritize ours in 2026. So keep your eyes peeled for an Action Alert email in New Jersey.
Thank you, Corinne. And it's interesting, one of the arguments we were discussing earlier, sort of opposition arguments, and there's always the discussion of this leads to that, leads to the other thing, which, is referred to as a slippery slope. Ugh, I shudder when I hear the phrase, but because it's not true, at least in the case of medically aid in dying. One of the examples that's often given is this idea of the way that laws have been improved, specific to waiting periods between requesting medication and receiving medication. Medical aid in dying has been the law in New Jersey since 2019. So we have years of data to show how waiting periods are working. And one of the things that I always impress upon people or try to is that it's not just an improvement bill for the sake of an improvement bill. It's because we have qualitative and quantitative feedback from folks on the ground in those states who say people aren't living long enough to use the medication if they request it. So yeah, that is one of those things that it's not an issue in every state, but when it is, we continue to work from a legislative and a legal standpoint to address those types of issues with whether they be waiting periods or residency requirements. So thank you so much. I look forward to hearing more about New Jersey as we get deeper into the year.
Patrick, can I just piggyback on what you just
Of
said?
course.
Because I think it's a really important point, this idea of a slippery slope. We hear it from opponents all the time. And I just want to be clear that while there have been improvements to bills across the country, none of those changes have touched the core eligibility requirements for medical aid in dying across the country. And that's a really important distinction because our laws are very different in the US from those in Canada, for example, and those in Europe. And so when opponents talk about a slippery slope, what they're really talking about is, or what they're really worried about is that our law's eligibility criteria will be changed to broaden eligibility. Some people on this call may think that that's a good thing, and that's a conversation for another day. But what's really important is knowing that since Oregon passed the first medical aid in dying law in 1994 by voter referendum, the core eligibility guidelines that you need to be terminally ill, mentally capable, self-ingest the medication, to doctors, that has never changed. So this idea of a slippery slope is a myth.
Yeah, there's no evidence to support that would be the case. I just posted also in the chat a link to a blog post about Canada's. They have a national program versus our state-based laws. That's just one of the differences, and you can read more about the differences there. And then, of course, you mentioned Europe has a whole slew of other policy that essentially has nothing to do with what we work on in states here.
Patrick, I saw a question in the chat from Judith in reference to Connecticut and wanting to know what's happening there and the progress. And I know that someone reached out and shared the link to the page and how to follow along in reference to what's going on. But in Connecticut, we do anticipate the session just started yesterday. We do anticipate lawmakers following a bill there soon. And then currently, they actually have a big effort taking place around outreach and education where they're doing film screenings. And I believe they have 18 to 20 different locations mapped out where they've been doing film screenings that have a discussion and a panel. And they're doing it in different lawmakers' districts too, and inviting them as well. So lots of activity happening in Connecticut in reference to outreach and education. And then we do anticipate the bill to be introduced soon.
Great. Thank you so much, Elizabeth. We're getting close to time here. We've got about 10 minutes left. Got a lot of questions about specific states. I want to thank Callie Riley, our regional campaign director, who is logged on here as well, answering those questions in the Q&A. So if you're getting a typed reply back, that's coming from Callie. Thank you so much for working on that with us here today. Question about the State Medical Society. Oh, that's out of Maryland. It looks like it says it helped in New York, and that is true. Yeah, I'm not seeing any other questions that it looks like we can address at the moment. So Elizabeth, do you have some words of wisdom to wrap up here today? And if we do get some more questions, we can certainly take.
Yeah, I think if more questions come in, we will be more than happy. I think Patrick, you and I answered 108 questions last time after the webinar, so we're more than happy to jump in and answer questions afterwards. But it'll be an exciting year. Again, it's already been exciting the last couple of days in reference to what's happening in this session. But medical aid in dying has never been a quick or simple policy conversation, though. And then since the early 1990s, 43 states have introduced bipartisan legislation. And many of those states where it is now authorized debated the issue for years before passage. For example, Delaware and New York each considered that bill for more than a decade. And in New Mexico, their first efforts spanned back to the 1990s. So, please know that we understand what it takes to pass. We are committed to the long run here, and we're going to be here to do the work alongside of all of you. So thank you very much. Thanks for joining us today.
Thank you so much, Elizabeth. Thank you, Corinne, for joining us, for hopping on. Thank you to Melissa, Stacy, who joined us a little bit earlier, and thank you all for being with us today. Advocates like those of you on this call make this work possible, and we can't do it without your time and also without your financial support. So if you can donate, we appreciate the support. I just posted a link in the chat that will get you to a donate page, and there should be a slide that you're seeing with some information on donating. Thank you all so much again for joining us today. Again, a special thanks to Callie Riley for working behind the scenes, answering all your questions. For everyone here at Compassion and Choices, we hope you have a great rest of your day and great year, and we will talk to you soon.
Thank you all.